Hi guys, Danelle Dixon, Performance Plus Physical Therapy here, and I wanted to record this video for you because you guys asked me for some information regarding how to relieve neck pain, some tips and some tools that you can use in order to relieve neck pain. It is a superbly stressful time, guys. I understand that tensions are high, and a lot of times if you're holding a lot of stress and anxiety, it can accumulate in the neck. So I'm going to show you two things that I think would be helpful for you to relieve some of the tension on your own at home. Okay, things you're gonna need is a tennis ball or lacrosse ball. I prefer a lacrosse ball. It's a little bit more firm. It doesn't lose that firmness over time. Tennis balls tend to do that. Go with the one that feels most comfortable for you. The pressure that it puts on it is something that is individual, so really kind of figure out what works best for your body, and that's the tool that you want to use. But you want something about this size, okay? So first of all, a little bit of anatomy to get you guys oriented to what we're going to be working on. A lot of the muscles that cross the neck, and they start all the way up here at the top of the neck, right at the base of the skull, actually also cross the shoulder. They go all the way down really to the base of your shoulder blades. So because of that, if you're having a lot of tension in your neck, you may notice that you may have some sort of issues going on with your shoulders also, and vice versa. If you have a shoulder issue, you may start feeling some neck tension happening. That's the reason for that. So the two tips that I'm going to show you guys today may help a little bit with both, but just be aware of that fact so that when you're working on these muscles, you're aware that how big and how long and how wide they are. I'll try to put a little bit of an insert of a picture of what that looks like for you in this video, okay? So the first one that we're going to do is we're going to work on mobilizing your first rib. So the first rib, and a lot of times we don't think of the ribs as anything that's down here in this area because they kind of enclose your lungs, but the ribs actually start all the way up here, okay? The very first one starts up here. There are two ways you can find this landmark. If you turn to the side and you put your hand on your ear, and you trace it all the way down and kind of drop a straight line down to your shoulder and just move about an inch back, that's the top of your first rib, okay? Another way that you can find it, if that doesn't quite work for you, if you look down, there's a bone that sticks out right at the base of your spine. That is C71, or your cervical, your seventh cervical spine, your first thoracic spine, okay? That's where the first rib attaches. If you go about 2 inches, 1, 2 across right there, that's your first rib. So you want to make sure that you're very precise with this, because if you don't want to mobilize the wrong thing, you're going to take this tennis ball and you're going to place it right on that spot, okay? And you're going to place it against the wall, as you can see right here, okay? Now you can stagger your legs a little bit, so that gives you a little bit more leverage, okay? And in this position, you want to slowly put some pressure on that spot. Not as much force as you can, guys. You want to pay attention to how your body feels. You just want to feel firm but strong pressure on that spot. And you're just going to hang out there, okay? What seems, because you feel like you want to rub and roll, and no, just kind of let it relax. And if you are really paying attention, which I hope you are, you'll feel that there's a little bit of a shift of those muscles, or you should feel like a little bit of a shift kind of moving you forward that way. Now it's not going to move forward 3 inches. It's a very small motion, maybe about a ½ an inch, okay? So that's what you're going for. If you feel that there's not enough pressure and it's not superbly painful, you can push a little bit more and you'll feel that motion happening. So you want to hang out there for just about a minute, okay? You kind of move it around just a tiny bit. So I'm just doing a little bit of an oscillation. I'm not rolling around, okay? A little bit of an oscillation, and you will feel that muscle just slowly relax. And I would say hang out here for maybe about a minute or so, okay? So that's number one. Now, very important thing that I should have said before, I'm a big fan of testing and retesting, meaning you look at how you move and how you feel before, you try something, then you test it again and see if that's the best tool for you. If it is, it would change, or if it's the right thing, or fixing the right thing, it's going to change. So before you move around, move your head around and see where you feel restrictions. Move it from side to side, rotate one side to the other, and see how that feels. And after you try this on both sides, retest it again and see where you feel restrictions or what has changed. And that's going to give you more information about what has been helpful. So that's tip number one. Number two, there are muscles that run all the way from the base of your spine all the way down to your tailbone, okay? We're gonna be working on the ones that sit all the way right here, again, to the base of the shoulder blade. So again, you're gonna take your lacrosse ball, your tennis ball, and I want you to place it right at the base of your shoulder blade, okay? Not directly on your spine, but right next to it, on that little beefy part right next to your spine, okay? So I'm gonna place it here. Here we go. All right, and again, stagger your legs so you have a little bit of a wide base of support, meaning one leg, my left leg is a little bit further out than the other. That's closer to the wall, okay? And you're gonna slowly lean into the balls. You feel nice firm pressure. That's the pressure you're holding. Again, don't jam all of your weight into the ball. That never feels good. You just wanna get a little bit of pressure in there and you hold it there. And then I want you to maintain that pressure as you glide it down. So basically you're rolling that ball all the way up towards your shoulder. You should start, I'm gonna put my hand this way so you can start seeing the ball, okay? So this is a good way, keep that pressure on, roll all the way down and back up, okay? The most important thing here is to keep in line with your shoulder, within that straight line. Do not roll over your spine. And make sure that you're maintaining the pressure all the way up and down, okay? So you wanna do that for about 1 minute on each side, okay? Holding your arm in this position as I'm holding it right now actually is pretty good because it puts that muscle in a little bit more stretch and exposes things a little bit more, which is good. And you will feel that stretch, okay? And again, afterwards, retest. So bend to the side, look up and down, turn each way and see how you feel. So try those two tips out. I'll write it out for you. Let me know how you feel. Give me some feedback. Hopefully this helps you. One last thing that I do want to say, this is not medical advice, guys. This is a tip that may be helpful for you. If you are experiencing symptoms that are consistent, a lot of these tips, you'll see a lot of these things online that may or may not be helpful for you. Try it out. If it doesn't, contact me, contact your physical therapist, get some medical eyes on it so you're getting the right treatment for you. This is generic stuff. If there's something serious going on, you want something that's specific to you. Okay, so I hope that was helpful and I'll talk to you guys soon. Bye.